I want to talk to you today about something that genuinely helps protect a great many older adults' hearts, and that's both underused and misunderstood. Heart checkups. The regular monitoring and screening that catch heart risks and problems early, before they cause a crisis. Because people often either avoid checkups, not wanting to know or not seeing the point when they feel fine, or misunderstand what heart monitoring is for and what it can and can't do, so they miss the genuine protection that sensible, regular checkups offer. So today, I want to explain why regular heart checkups and monitoring matter, what they typically involve for older adults, why catching things early is so valuable, what to be realistic about, and how to make the most of them in partnership with your doctor. And I'll keep this calm and practical, because while this involves engaging with your doctor, understanding the value of regular heart checkups and being an active participant in them lets you catch and address heart risks early, which is one of the most powerful ways to protect your heart, especially since so much heart risk is silent. This is about sensible, proactive heart care in partnership with your doctor. Let me start with why regular heart checkups matter, because the reason is rooted in something I've stressed throughout. So much heart risk is silent. As I've discussed, the major heart risks, high blood pressure, high cholesterol, the artery clogging process, and others, are often silent, causing no symptoms while they build and do damage over years, until they result in a heart attack, stroke, or other crisis. This silence is exactly why regular checkups and monitoring matter so much. Because you can't feel these risks, the way to catch them is to measure and check for them regularly so they can be identified and addressed before they cause a catastrophe, rather than waiting for symptoms that may only come as the crisis itself. So regular heart checkups matter because they detect the silent risks, high blood pressure, high cholesterol, and others that you can't feel but that are building danger, allowing them to be caught and managed early before they cause a heart attack or stroke. This is the whole logic of checkups. Find and fix the silent dangers before they strike. So regular checkups matter because they catch the silent risks before they cause a crisis. So checkups catch what you can't feel. So the silence of heart risk is why checkups matter. Let me explain what heart checkups and monitoring typically involve for older adults, because understanding it demystifies them. Heart-related checkups and monitoring for older adults typically involve some combination of measuring your blood pressure, since high blood pressure is a major silent risk, as I've discussed. Checking your cholesterol with a blood test as part of assessing your risk. Checking for or monitoring diabetes with blood sugar testing, since diabetes is a major heart risk. Assessing your overall cardiovascular risk, considering your blood pressure, cholesterol, age, smoking, diabetes, family history, and other factors together. Reviewing your weight, lifestyle, and risk factors. Reviewing your medications, and, depending on your situation, your doctor checking your heart, pulse, and rhythm, and arranging further tests like heart tracings or others if indicated. For those with known heart conditions, monitoring also involves keeping an eye on the condition and adjusting treatment. So heart checkups for older adults typically involve measuring blood pressure, checking cholesterol and blood sugar, assessing overall cardiovascular risk, reviewing lifestyle and medications, and checking the heart with further tests as indicated to detect and monitor the silent risks and any conditions. Understanding that checkups are mainly this sensible monitoring of your risks demystifies them and shows their value. So checkups are sensible monitoring of your heart risks. So knowing what they involve demystifies them. Let me explain why catching things early is so valuable, because that's the payoff. Catching heart risks and problems early through checkups is so valuable because early detection allows early management, which is far more effective than waiting for a crisis. If high blood pressure is caught early, it can be controlled before it damages your arteries and heart and causes a stroke. If high cholesterol or high cardiovascular risk is identified, it can be managed through lifestyle and, where appropriate, medication before a heart attack. If diabetes is caught early, it can be managed to protect the heart and prevent complications. If a heart rhythm problem like atrial fibrillation is detected, it can be treated to prevent a stroke, as I've discussed. If early heart disease is found, it can be managed to slow it and reduce risk. So in every case, catching the risk or problem early before it causes a crisis allows it to be managed in ways that genuinely prevent or reduce the devastating events, which is far better than discovering it only when the heart attack or stroke strikes. So catching things early is so valuable because early detection allows effective early management that prevents or reduces heart attacks, strokes, and other crises, which is the whole point of checkups and far better than waiting for the catastrophe. So early detection enables prevention, which is the payoff. So catching things early genuinely prevents crises. Let me be balanced and realistic, because I don't want to overstate what checkups do. Regular checkups are genuinely valuable, but let me be accurate about what they can and can't do to set sensible expectations. Checkups and monitoring detect and help manage risks, but they don't guarantee nothing will ever go wrong, and they're not a substitute for the healthy living and risk management that actually protect the heart. So checkups identify what to address, but you and your doctor still have to address it. Also, not every possible test is needed for everyone, and which checkups and tests are appropriate depends on your age, health, risk factors, and situation, which your doctor determines. So it's not about getting every test imaginable, but the sensible monitoring appropriate for you. And checkups can sometimes find things of uncertain significance, which your doctor interprets. So be realistic. Checkups are genuinely valuable for detecting and managing risks early, but they don't guarantee against all problems, don't replace healthy living, and should be the sensible monitoring appropriate for you, determined with your doctor, not every test imaginable. So value checkups realistically as genuinely worthwhile, sensible monitoring that detects risks to address, not a guarantee or a substitute for healthy living. So realistic expectations keep checkups in proportion. So checkups are valuable, but not a guarantee or substitute. Let me address the common reasons people avoid checkups, because overcoming them matters. People often avoid heart checkups for understandable but mistaken reasons. The first is feeling fine and seeing no point, when, as I've stressed, the whole value is catching the silent risks you can't feel. So feeling fine is exactly when checkups help, not a reason to skip them. The second is not wanting to know, fearing what might be found, when in fact finding and addressing a risk early is far better than letting it silently cause a crisis. So knowing is empowering, not something to avoid. The third is thinking checkups are unnecessary or that nothing can be done, when in fact much can be done to manage heart risks once found. And the fourth is simply not getting around to it. So overcome these. Understand that feeling fine is exactly when checkups catch silent risks. that knowing and addressing a risk early is far better than a preventable crisis, that much can be done once risks are found, and that it's worth getting around to. So overcoming the mistaken reasons for avoiding checkups, feeling fine, not wanting to know, thinking them unnecessary, or not getting to it, by understanding their real, early detection value, lets you get the protection they offer. So overcome the reasons for avoiding checkups, since their value is real. So don't let mistaken reasons keep you from checkups. Let me give you how to make the most of heart checkups, because being an active participant helps. To get the most from heart checkups and monitoring, be an active, engaged participant with your doctor. First, have your blood pressure, cholesterol, blood sugar, and cardiovascular risk checked and monitored as your doctor advises, keeping up with the recommended monitoring for your situation rather than skipping it. Second, ask your doctor what your numbers and your overall heart risk are and what they mean, so you understand your situation, as I've discussed. Third, discuss what you can do to address your risks, lifestyle, and where appropriate, medication, and follow through, since checkups only help if you act on what they find. Fourth, take any prescribed medications consistently and attend follow-up monitoring. Fifth, report any symptoms or concerns to your doctor, and don't rely only on routine checkups if something arises between them. And sixth, keep up your healthy living regardless, since checkups complement, not replace it. So make the most of checkups by keeping up the recommended monitoring, understanding your numbers and risk, discussing and acting on what to address, taking medications and attending follow-up, reporting symptoms, and keeping up healthy living. So active, engaged participation in your checkups and acting on what they find is how you get their protection. So engage actively to get the protection checkups offer. Let me paint you a picture of how regular checkups protect you. Picture a man in his 70s who feels fine and so avoids checkups, seeing no point and not wanting to know, while silently his blood pressure and cholesterol are high and his cardiovascular risk is building, unknown to him. In the avoidant version, these silent risks go undetected and unmanaged, until one day they cause a stroke that could have been prevented. The missed checkups having let the silent dangers build unchecked. Now picture him understanding the value of checkups. He realizes that feeling fine is exactly when checkups catch silent risks, and that finding and addressing them early is far better than a preventable crisis. So he has his blood pressure, cholesterol, and blood sugar checked, and his cardiovascular risk assessed, and his doctor finds his high blood pressure and cholesterol, which were silently endangering him, and they address them through lifestyle and medication, controlling them before they cause a catastrophe. A routine check also picks up an irregular pulse, leading to catching atrial fibrillation and reducing his stroke risk. His silent risks are found and managed early, genuinely protecting him from the stroke and heart attack they were heading toward. The same man, but valuing and engaging with regular checkups, caught and addressed the silent dangers in time. That contrast is exactly why regular heart checkups, far from pointless, are one of the most powerful protections, precisely because so much heart risk is silent. So regular checkups caught and addressed his silent risks in time. And let me speak directly to those of you caring for or close to an older person, because checkups are underused, and you can help. Understand that so much heart risk, high blood pressure, high cholesterol, the artery clogging process, is silent, causing no symptoms while it builds danger, which is exactly why regular checkups and monitoring matter, to catch these silent risks early so they can be managed before they cause a heart attack or stroke. You can help by encouraging regular heart checkups and monitoring, blood pressure, cholesterol, blood sugar, and cardiovascular risk assessment as their doctor advises, and helping overcome the common reasons for avoiding them. Feeling fine, not wanting to know, thinking them unnecessary. By understanding that feeling fine is when checkups help most, and that finding risks early is empowering. Help them be active participants, understanding their numbers and risk, acting on what's found through lifestyle and medication, taking medications consistently, attending follow-up, and reporting symptoms. Support the healthy living that checkups complement, and help them keep up appointments and monitoring. Helping a loved one value and engage with regular heart checkups can catch and address their silent risks early, one of the most powerful ways to protect them from heart attacks and strokes. So your help encouraging and engaging with checkups genuinely protects them. Let me draw this all together. Regular heart checkups and monitoring are genuinely valuable and underused, and they matter because so much heart risk, high blood pressure, high cholesterol, the artery clogging process, and others is silent, causing no symptoms while building danger. So the way to catch these risks is to measure and check for them regularly, allowing them to be managed early before they cause a heart attack or stroke. Heart checkups for older adults typically involve measuring blood pressure, checking cholesterol and blood sugar, assessing overall cardiovascular risk, reviewing lifestyle and medications, and checking the heart with further tests as indicated. Catching things early is so valuable because early detection allows effective early management that prevents or reduces crises, far better than waiting for the catastrophe. Realistically, checkups detect and help manage risks, but don't guarantee against all problems or replace healthy living, and should be the sensible monitoring appropriate for you. People avoid checkups for mistaken reasons, feeling fine, not wanting to know, but feeling fine is exactly when checkups catch silent risks, and knowing is empowering. Make the most of checkups by keeping up the recommended monitoring, understanding your numbers and risk, acting on what's found, taking medications, attending follow-up, reporting symptoms, and keeping up healthy living. All in partnership with your doctor. So here's what I'll leave you with. First, understand that so much heart risk, high blood pressure, high cholesterol, and the artery clogging process is silent, causing no symptoms while it builds danger, which is exactly why regular heart checkups and monitoring matter, to catch these silent risks early before they cause a heart attack or stroke. Second, know what heart checkups typically involve: measuring blood pressure, checking cholesterol and blood sugar, assessing your overall cardiovascular risk, reviewing your lifestyle and medications, and checking your heart with further tests as indicated, so there's sensible monitoring of your risks. Third, value catching things early, because early detection allows effective management that genuinely prevents or reduces heart attacks, strokes, and other crises, far better than waiting for the catastrophe. Fourth, overcome the mistaken reasons for avoiding checkups, understanding that feeling fine is exactly when they catch silent risks, that finding and addressing a risk early is far better than a preventable crisis, and that much can be done once risks are found, while being realistic that checkups detect and help manage risks, but don't guarantee against all problems or replace healthy living. And fifth, make the most of checkups as an active participant. Keep up the recommended monitoring for your situation. Ask your doctor what your numbers and overall risk mean. Discuss and act on what to address through lifestyle and medication. Take any prescribed medications consistently. Attend follow-up. Report symptoms. And keep up your healthy living. Regular heart checkups are one of the most powerful ways to protect your heart, precisely because so much heart risk is silent. So they're well worth valuing and engaging with rather than avoiding. So take care of yourself. Keep up your heart checkups. Understand and act on what they find, and stay an active partner with your doctor. And because heart checkups, risk assessment, and management require a doctor, please treat regular heart monitoring as something to keep up in partnership with your own physician, acting on what's found rather than avoiding it or treating it as a substitute for healthy living. And report any symptoms or concerns between checkups.